Physicians and public health officials are frustrated as hospitals continue to fill up, and state officials are exasperated as they say some Utahns continue to disregard critical health guidelines that slow the spread of COVID-19.
I don't know what to do anymore. We as a state, we have set the table. We're prioritizing and focusing on individuals taking responsibility to slow the spread of COVID-19.
The frustration is evident in the voices and faces of Utah's public health leaders.
I'm really not trying to scare anyone. I'm just trying to inform you of what's going on.
For the first time as a physician, I'm scared to see what's to come.
COVID-19 cases keep climbing and hospitals are reaching capacity.
Patients in our hospital range from 19 years old to 90 years old. Approximately half of them were in the ICU. All of them are suffering, they're alone, and they don't have the comfort of their family or their friends nearby. Many won't make it, unfortunately.
Utah's healthcare systems are in danger of being overwhelmed. They're already moving patients around to make room for more, and they say this is all preventable.
Our caregivers are tired, they're emotionally spent, and they're frustrated, and sometimes they're even angry. When the situation we find ourselves in. They're frustrated when we see individuals and communities and occasionally local governments not heeding the advice of scientists and public health experts.
Under the new COVID-19 risk scale and restrictions, most of the state is now at the highest level. It's because cases keep climbing. The biggest factor, people are gathering in social groups, unmasked and not distant. But the governor says there's not much more they can do in terms of restrictions.
You've asked and asked and asked people to do the right thing, and clearly people are still gathering in groups. They're still not practicing physical distancing. They're still not wearing masks. So what can you do policy-wise to get them to do it?
We put a policy in place that I think will work.
Under the high-risk levels, casual social groups are limited to less than 10 people. Face masks are required across most of the state. He says Utahns must do their part.
By following proper protocols to minimize risk to ourselves and to our loved ones and to the community at large.
Now, the governor says this is a balance of lives and livelihoods, meaning the economy. He urges Utahns to continue to practice physical distancing, staying 6 feet apart from each other, limiting those social gatherings among family and friends, practicing good hygiene, including washing hands, and, of course, wearing face masks. Live on the Hill, Ben Winslow, Fox 13 News, Utah.